ago, somebody went into cardiac arrest. They used the tincture. That's why I say keep tinctures on you as well for people when you're out in the world. They used 1 drop full of tincture and the person came out of the cardiac arrest. That stuff revives people. It is life-saving. It's no joke.
Sister White says the 2 things we should have on us at all times: cayenne pepper and garlic.
Wow.
At all times.
Okay. So jaw and then the neck. Alrighty. Now what are the signs of a stroke? Not my doctors and nurses. Signs of stroke. Okay. Let's use the first 3 letters of stroke. That's how you remember. S equals slurred speech. No, sorry, it does not. S equals smile. How do they smile? Is it crooked? Is their face like stiff? Okay, that's what S stands for. T equals talk. Do they have slurred speech? Okay. And then, does anyone know what R stands for? Raise your arms. You always tell a stroke patient, if you think they're having a stroke, raise your arms. If they do this, that means they've had probably a stroke. If they can't raise both their arms above their head, unless they have arthritis pain in the shoulders or something, we're talking, people who are not having that problem, chances are they have a stroke. And you can also use half a teaspoon of cayenne pepper, mix it in some warm water, have them drink it. It works wonders for a stroke.
I have a question.
Yes.
Sometimes a stroke is caused by hemorrhaging. Would cayenne work on that too?
Well, hemorrhaging, cayenne helps with clotting and prevents bleeding and stuff like that. Yes, so I would say yes. Any little thing that we can do to call, while we're waiting for 911 can be life-saving. It just takes that one little thing, and you can save somebody's life. So yes, if it's dealing with bleeding, then yes.
I heard also in the signs of heart attack, I think what pastor, the one who Irish, he was having this stomach pain.
Okay.
And it was really, really bad. And
Okay.
When he went to the hospital emergency, the doctors also was saying to him that heart attack.
Yes, another thing they mistake, they think that the GERD, the heartburn, they mistake the heartburn, but it's actually they're having a heart attack.
Yes.
That happened to my landlord.
That's because of the vagal stimulation.
The vagal stimulation of one of the nerves.
So you were saying that by having what you call the cayenne?
Yes.
Just put it in
Under the tongue. And you do it like you do nitroglycerin. This is what you do. You do a pinch under the tongue, okay? And then you wait 5 minutes, just like you would do nitroglycerin. The only thing is here is this normally works immediately, within, I'm talking seconds. And you do it for 5 minutes, okay? Then you try it 2 more times. Now, if I'm dealing with somebody who's not a friend or family, I'm going to call 911.
Yeah.
If they're having a heart attack, because I don't want any liability, call 911. Utilize 911 because families will try to sue you. You know what I'm saying? But do this in the meantime. Now, if it's your friend, if it's your family, you don't need to call. I wouldn't call 911 if it's one of them. When I'm going through chest pain, I used to have chest pain years ago. I do the cayenne, it stops instantly. You do it times 3 times. Okay? The first time it normally works. But with nitroglycerin, you do it and you wait 5 minutes. And then you take nitroglycerin again and you wait 5 minutes. And you do, and then the 3rd time, if it doesn't help, you don't even need to call 911 really the first time. Because even with nitroglycerin, they tell you don't call the hospital until you've done it the 3rd dose and it doesn't work. So you do the same thing with cayenne. Do it 3 times. But I'm telling you, more than likely, you won't need to do it the 3rd time. But this is a vasodilator. Somebody's watching and saying, how can cayenne? And go on YouTube, Google, type in cayenne for heart attacks, cayenne for bleeding. You'll find thousands of pages regarding this. This is not just something I'm up here saying. Medical doctors, medical science is proving this is effective, yes.
What was the formula again for stroke? Mixing it in water?
Oh, half a teaspoon. They say start with half a teaspoon. You can do the tincture because sometimes their mouth they can't drink. You can do the tincture on the side of the mouth and put their head back sideways so they don't choke. Yes, and that's all that's required. Any other questions? Okay. Yes.
How do you test for it?
How do you test for what?
You gave the symptoms, but then my testing that I was thinking about.
You mean testing the doctors do?
No, for cholesterol. Say I'm not here, and this person, I don't know what
Oh,
this, you know,
testing for cholesterol.
cholesterol for cholesterol.
You tell me you want your triglycerides, you want a complete cholesterol count, you want a lipid panel.
No, I'm just talking about, well, look, I ain't had a chance to have this person go into and get this test. Now I run into this person with a problem. Now, how do you
What
diagnose?
problem? I'm not
A
understanding.
cholesterol problem.
How do you know they have a cholesterol problem if they haven't been tested?
They might have been too fat.
That
That's what I want to
doesn't,
know.
obesity,
I just want to know.
Okay.
How do you detect that they have the cholesterol?
their blood tests,
Blood test.
the blood test.
So what if you're out somewhere and you don't know what things, what they
What'd you say? You don't know if they have cholesterol if they haven't had a test. That's the only way you can find out. That's the only way you find out for cholesterol if they haven't had a test. Now, let me say something about the blood test. There are some people who disagree with blood tests. I'm here to let you know Sister White approved of blood transfusions. And I'll bring the quote next week. If it's going to save their lives, she approved of blood transfusions. And I'll bring the quote. I thought she wouldn't have approved of it, but she did.
But it's very dangerous not to have
Absolutely. It's dangerous of HIV and stuff like that. There are things you can do to raise, we have knowledge today, you can raise up your blood count levels. But my point is this. I don't know what your problem is if I don't know what your blood tests are. You know what I'm saying?
That's right.
How do I know what your cholesterol levels? I need to know your problems in order to know. Now here's the thing. We have one formula for every disease. Remember we said that in the past? But then according to the disease, we're going to use different what? Herbs and remedies. Okay? So what works for heart attack is cayenne is not going to work for the liver. You need the milk thistle and other things for the liver, the dandelion and stuff like that. So how do we know if they have liver problems, liver failure, kidney failure? It's according to the lab result. And so one day we're going to have an entire class on lab results, what the letters are and what the ranges should be. Yes.
Now we have tests that your ophthalmologist or your optometrist do. All they do is look at your eye. There's a blue coating over your eye and tell you whether you have a cholesterol problem.
What is that? That's a simple test.
I was gonna say, if you're speaking to someone in the street, I'm wondering if you're speaking to someone in the street, you're not gonna be able to know if they have high cholesterol by looking at them.
No.
But you can definitely ask them, are you on high meds for high cholesterol?
That's right. And a lot of
Most them
people
will
are.
say yes.
Most
So then you
people
know that they
in
have high cholesterol.
America in 2010, they're older, they're on some kind of statin. And do you know what you cannot give them if they're on a statin? A statin is the cholesterol medication. Do you know what stuff you cannot give them if they are on cholesterol medications? This is the number one no-no. That's why we need to know about what people are on. Number one no-no equals grapefruit juice. Grapefruit juice is contraindicated for those who have statins. Garlic is contraindicated in those who are on statins for a lot of people. Garlic. This is the number one no-no. So remember we were talking about the remedy for gallstones and stuff? You need to find out if they're on a statin.
Is there any reason why you don't want to have it?
Because this is going to bring you down, and if you combine it with this, it's going to really bring you down. And there's a danger of the combination of the two. And in any drug book, it'll tell you all the contraindications, but you cannot give grapefruit juice to somebody who's on statins. That's one thing I learned. And I dealt with mostly heart patients, and if they're a heart patient, they have cholesterol problems in most cases. Okay?
So
I'm just gonna cover a few more things. What was your question?
Are you saying they can have grapefruit then?
Cannot.
I'm saying, but you're specifying the juice.
No grapefruit juice. I'm sorry I didn't clarify. No grapefruit juice. And no garlic. Okay? Because this is gonna bring them low. This does bring them low, but this is very deadly to your health. This causes kidney failure. Your calcium levels are really low. I mean, this causes so many problems in the body. All right. Just a couple more things, and then we're going to stop for today. What other items cause cholesterol? We talked about it earlier. Animal items. But think of an animal item that would really cause cholesterol.
Eggs, juice.
Somebody said the second one. Cheese. Do you know why? You know what? First of all, what did I say cheese has in it? Same thing that pork has. Tyramine. Tyramine. Cheese has tyramine in it, which makes your blood pressure go up immediately. And what did we say cheese was coagulated with? Rennet. And they use cow lining. But what did we say was the cheapest source of rennet? Pork. So, even if you're vegetarian and you don't eat pork, if you're eating cheese, you're eating pork. Because they're using the rennet. Okay. Do you know we should never eat cheese according to the spirit of prophecy? How many knows that? Have you guys read that?
Yeah.
Where did I put my book? She says that it is unfit for food. That's right. And also, did you know that cheese is fermented? It sits. It's fermented. Are we supposed to eat anything rotten? Cheese is a rotten food. Did you know that? Yes. And the older it is, the more expensive it is, and the more delicate. You know, they say it's a delicatessen. Seems like the abominable foods are the most expensive in the world.
Yes.
Amen. Yes, because of the tyramines, it forms something called hypertensive amines, which causes the increase in the blood pressure. That's why eating the cheese causes the hypertension. 39% of those who have, oops, I dropped my lace. 39% of people who have high cholesterol have hypertension. Now, here's the thing, and this is almost a fact. Medical science is proving this to be true. What do I mean when I say non-doctors and nurses hypertension? What does that mean? Who knows what hypertension is? High blood pressure. 39% of those with cholesterol, high cholesterol, have hypertension. Now, this is something important to know when dealing with those with cholesterol. If a person eats animal fat, let's say they eat a cheeseburger 2 times a day. Who saw that movie with the McDonald's guy, Super Size Me? Who saw that? In how many days did he go from healthy to sickly? 30 days. Halfway through it, what was his doctor begging him? To stop. He told him what was going to happen to him. So within a matter of days and weeks, you can go from healthy to sickly, right? Remember we learned about the doctor who did the study for diabetes, and he took 2 groups of healthy young men, and in one group he gave them 65% fat diet, and the other group he gave them 1 pound of sugar every day.